Hey everyone, welcome back to the channel. Today what I wanted to do is talk about non-surgical spinal decompression. There are many people who are struggling with neck pain, low back pain, and even wondering if this might be a treatment that might fit for them. So today what I'm going to do is I'm going to talk about what non-surgical spinal decompression is, how it works, what kind of conditions does it treat. So hopefully by the end of this video you'll have a clear understanding of what it is, how it works, and whether this is a treatment that might work for you. What is non-surgical spinal decompression? So non-surgical spinal decompression is a therapy that works on alleviating pressure on your spine by gently stretching it. So the goal is to create space between the vertebrae and especially around the discs themselves and the nerves and the spinal joints. So this therapeutic technique is what is going to relieve the symptoms associated with disc problems and the pressure on the nerves, such as the numbness and the tingling. How does it work? So non-surgical spinal decompression is a motorized table that we use, and basically what it's designed to do is allowing the therapy target specific areas, pressures building up, and as we do this, the spine is gently stretched. It creates negative vacuum pressure within the discs, which can help to retract the bulging disc or the herniated disc and alleviate nerve compression. So when we take a look at this model here, we have the two bones, we have the disc in the middle, we have these nerves that are coming out from every level there. So what happens is we have a disc herniation or a disc bulge. So this would be a bulge, and then the herniation would be when that material actually pushes out. So you see that red stuff coming out. So that's the disc bulge or disc herniation coming out. So as this is happening, there's a lot of pressure pushing down. So as we're on the table, what we're going to be doing is we are going to, as this is bulging here, the table, what it's going to do is gently pull, and we can even use it to do some pumping action, so it can go back and forth. And as it's doing this, it's actually allowing that disc to be retracted back in, reducing the pressure on those nerves, and then reducing the symptomatology that's happening. And then obviously you can feel and heal better. So when we apply the gentle tractioning or a decompression to the spine, what it's going to do is it's going to increase the space between the vertebrae. So as it's increasing the space between the vertebrae, it's going to reduce the pressure on those discs, and this is going to promote increased movement of the water, the oxygen, and the nutrients into the discs, which is going to help with the healing process. So the key is to create that vacuum-like effect within the disc, and as that vacuum effect is happening, it's going to retract the disc back into its proper position, therefore reducing the compression on the surrounding nerves, which is going to help in the healing process. Non-surgical spinal decompression is beneficial for a variety of conditions. Herniated or bulging discs. So this treatment can help with helping to pull that disc material back into place, which will help to take pressure off of the nerves. Sciatica, which is pressure on the sciatic nerve. So this is a very common condition that we use spinal decompression for. Degenerative disc disease. So this is where the discs are losing their cushioning. There's a lot of pain. So instead of the nice cushioning that we have here, this would be an example of where would see degenerative disease. So you can see how much disc height loss there's been. There's been arthritic changes that are happening in that joint as well. Set joint arthritis. So this is where the joints of the spine actually become inflamed, and this can also cause pain and stiffness. Spinal stenosis is where see the spinal cord running through the length of the vertebrae here. Actually get stenosis as well, and what that means is that space for the spinal cord itself is getting smaller, and we're getting pressure on the spinal cord or the nerves as they exit. If you're experiencing any of these conditions, spinal decompression may be a treatment option that would help. So who is spinal decompression not for? So spinal decompression is generally safe. Again, it's not for everyone. Obviously, if you're pregnant, don't advise spinal decompression. If you have osteoporosis, the stretching may pose a risk for weakened bones. If you have any type of spinal fractures, any of the changes that we're doing or the stretching mechanism that we're going to be using can aggravate that injury. Certain types of spinal tumors, infections may also be contraindicated to spinal decompression. Before starting non-surgical spinal decompression, what we usually ask for is some diagnostic imaging. So that may be an X-ray or an MRI. This just helps us to assess the health and condition of your spine. So X-rays are very useful in evaluating what the structure of your bones and joints are. It can help us to understand what the misalignments may be along the pelvis or along the vertebrae. MRIs are more detailed, so we're going to get a closer look at the actual soft tissues like the discs, the nerves, and the ligaments. This can be very helpful in determining if there's a bulge or a herniation and exactly what levels it's at. And this can help us be more specific with the treatment. What can we expect in terms of the treatments? So treatment protocols vary depending on what we're treating, the severity of the condition. Typically, we're looking at anywhere from like 24 to 36 sessions. So it's really important to understand that non-surgical spinal decompression is not a quick fix. We do need to commit to multiple treatments, and it can take weeks for you to feel benefits. However, when we do get the benefits, it can be life-changing. The sessions include laser therapy as well. So we use class 4 laser, which helps to clean up the area, helps you warm up the tissues before we actually do the non-surgical decompression, but it also helps to clean up the inflammation that's happening in the area that can also be contributing to the discomfort or pain that we're experiencing. And we also do spinal adjustments. They're very gentle. We use our drop table, so it's not really any rotation or anything that we're going to be inducing into the spine. We find that when we combine all of these treatments together, we get optimal results. Some of the feedback that we get from our patients is that they report feeling relief after just a few sessions. So essentially, we want to make sure that we follow the full recommendation of the treatments that we're recommending. Non-surgical spinal decompression can be an effective, non-invasive treatment for certain spinal conditions. If you think this might be a right fit for you, make sure you consult with your doctor. They will help you to determine the best treatment plan based on your unique needs. Also, remember, there's a link to another video here where I explain more of what's happening at that spinal or disc bulge level. And then I've also included some very helpful exercises and tips for you to help avoid lower back pain when you're dealing with disc bulges. Thank you for watching. And if you found this video helpful, don't forget to like and subscribe for more informative content on back health and treatments.